Hi everyone, welcome back. So let's resume with our Aeon topic, people not professionals. So we need to just cover the last part of this Aeon topic, last series, which is this one. The champions facilitate access to social entitlement and provide practical support. Let's see what the species hold. This series hold for us. Let's start with the first species. Take Atmiyata, for example, an innovative rural community led intervention in the aforementioned Mehsana district in Gujarat that is currently delivered by the organization where we are based. Atmiyata focuses on identifying and providing between 12 and 14 days of training comprising role plays, group discussions, and input sessions to build the capacity of community volunteers. At the village level, as lay mental health care providers to deliver evidence informed counseling to support people in distress or with common mental disorder such as depression and anxiety. These lay counselors or champions reach out to their village community members using their training to identify symptoms of mental health condition and social condition that might be distressing the community members such as newly married woman who is moving to a new village, recent unemployed, women facing domestic violence or financial distress, and the champions use Atmiyata films to facilitate a conversations on mental health. So basically, this basis is talking about a program Atmiyata in which the counselors counseling the peoples who are, for examples, newly married women's, recently unemployed women facing domestic violence or financial distress. So this is basically for the women. And so it's a story. The whole passage is about how Atmiyata works. So the title of this whole passage is The Working of Atmiyata. So, and this program is launched in Gujarat, Mehsana district of Gujarat. So let's see what Atmiyata have. So Atmiyata focuses on identifying and providing between a 12 and 14 days of training comprising a role play, group discussions and input session to build the capacity of community volunteer. And what its motto is, lay a mental health care provider to deliver evidence informed counseling to the support people in distress or with common mental disorders such as a depression and anxiety. And what it takes, these lay counselor or champions reach out to their village community members using their training to identify symptoms of mental health condition and social condition that might be distressing to the community members. That's all, and here the given examples are. And the champions use film, Atmeta film, to facilitate a conversations on mental health. So because of these way, they just try to aware the people of the village how to face mental distress and anxiety and what are the symptoms of that if they are not aware of about that. So let's moving to what the next piece is. On their first few interaction, the champions make an assessment of the people's level of distress and subsequently use lay counseling skills and techniques over a 4 to 6 interactions to provide emotional support and assist them in identifying and reaching their goals. In addition, the champions also facilitate access to social entitlement and provide practical support such as sharing employment opportunities, making referrals for legal aids, shelter services, and helplines they might need to assess. So what kind of assessment these champions or counselors do? So that it's just talking about what the techniques they are using to support those peoples who are suffering from the mental distress and anxiety. So the help they provided are employment opportunities, legal aids, referrals for legal aid, shelter services, and helplines numbers, we can say, or through any other ways. So, so the title of this whole passage is Initially How Champions and Counselors Help People. Firstly, providing emotional supports, assist them in identify and reaching their goals, how they can reach their goals, and also facilitate access to social entitlements, provide a practical support such as the sharing employment opportunities, making referrals for legal aid, shelter service, or helpline might need to assist. This way, they are helping them. So let's moving toward the next basis. At present, there are 1,000 such volunteers across 1,200 villages who are actively providing peer support through this intervention. A majority of the volunteers join the interventions given their lived experience of distress and mental health problems. Using the unique position of the village based volunteer, services can be provided on those in need in acceptable manner, free of cost, at people's doorstep. Our results show that the people who interact with the peers were twice as likely to recover from their symptoms of common mental disorder as compared with the control group, and also show the sustained benefit 8 months later. The World Health Organization has listed Atmiyata as one of the 25 good practices for community outreach mental health services around the world. So it just the brief overall recognition and description about the works of Atmiyata. So it start with that there is a initially it's few, but now Atmiyata have 1,000 volunteers and they are working across 1,200 villages, and the support they are provided is completely free of cost at their doorstep. And it also shows that the result of their work is that now the people who are interacted with the peers were twice as likely to recover from their symptoms of common mental disorder as compared with the control group, or also shows a sustained benefit 8 months later. So it says that the people who are just contact or in contact in interaction with the peers group means who are already the victim of that kind of a suffering, who came out from that sufferings, now they are helping with these peoples. The people are more easily recover by interacting with them rather than the control groups who are which are initially made. And the best result we can get after 8 months. Even this Atmiyata is recognized by the World Health Organizations, and they consider it as one of the 25th good practices for community outreach mental health services around the world. So, it's a brief description about the achievements of Atmiyata. And what we can take from here is that provide services can be provided to those in need in an acceptable manner, free of cost, at people's doorstep. The first is this. And people who interact with the peers were twice as likely to recover from their symptoms of common mental disorder as compared with the control group also shows a sustained benefit 8 months later. And WHO has listed Atmiyata as one of the 25th good practices for community outreach mental health services around the world. That's all for this species. Moving toward the next species. Sorry, this one is quite long, but let's do it. Another promising example of peer support is a different setting in Outlife, a youth suicide prevent program, for which we are pilot testing a youth peer support program that train youth volunteers aged 18 to 24 from university and community-based organizations to provide chat-based emotional support to young people in distress and having thought of ending their lives. The youth volunteer provided with 30-hour online training in basic gatekeeping, such as identifying warning sign of suicide, assessing suicide risk, providing emotional supports, and making a referral to other helplines and organizations. This support is provided via text-based chat on an online app that we co-design with young people and with a maintain the anonymity of both the peer supporters and the young support seeker throughout. Peer support programs for suicide prevention such as Outlife are premised on the principle that one doesn't have to be professional or expert to support an individual with suicidal thoughts and feelings. Rather, shared life experience as community member or peers complemented with lay skill to provide emotional support and maintain a suicide risk can help prevent suicides, especially in the absence of immediate formal support. So this species is talking about Outlife, a youth suicide prevention program. So it is basically for the young peoples, the people the age between 18 to 24, and here they provide a volunteer support with a 30-hour online training, the training for identifying the warning sign of suicide, assessing the suicide risk, providing emotional supports, and making referral to other helplines and organizations. This kind of training provided to the volunteers of this program. And how they help the youth, how this help, these training programs help. There is an online app which is Outlive, and which is co-designed by the young people to maintain the same peer support. Okay, we can just say that if young people better know their own conditions. So peer support program is the how it can work, that it's provide online support. You can just talk to the peer member of the community and they immediately provide you emotional support and help you to prevent suicides. It is especially absence of immediate formal support until and unless they can provide you any benefit, any other support for the immediate formal support, they can talk you online. So the title of whole passage is Outlife, a youth societal program prevention program. And what we can take from this passage is that is a peer support program that train youth volunteer aged 18 to 24 from universities and community-based organizations to provide a chat-based emotional support to young people in distress and having thought of ending their life. And it's an 30-hour online training in basic gatekeeping such as identify warning signs of suicide, assessing suicide risk, providing emotional supports and making referrals to the other helplines and organizations. And this support provided via text-based chat on online app that we co-designed with the young people. And it doesn't want one to have a professional or expert to support an individual with suicidal thoughts and feelings. Provide emotional supports and manage suicide risk can help prevent suicide, especially in absence of immediate formal support. So that's all for this passage. Let's moving toward the next one. Despite these promising interventions, there are many challenges ahead, including a need to convince policymakers to look beyond conventionals, professional led models of mental health support. Unfortunately, there are currently very few peer support programs that are actually integrated in the delivery of the public mental health service at scale covering large, diverse population across the different geographical areas. Nonetheless, we are hopeful. So basically, we are just summarizing this whole passage that this passage is trying to say that the above mentions programs are not just enough. There is also need various policy making to support a mental health problem. But unfortunately, we have very few peer support programs that are actually integrated in the delivery of the public mental health service with diverse populations across the different geographical areas. So that's all. But the species is moving toward the last species of this eon. Peer support shows that change is possible, that mental health is not the exclusive domain of mental health experts such as a psychiatrist and psychologist. Rather, mental health is universal and relational. We have varied experience of mental health, which are shaped by our relationship with each other and the world. Peer supports has the potential to bring a paradigm shift, to reclaim the expertise of person with lived experience to shape a mental health care pathway and control their own recovery journey. So this species is talking about that the mental health is not just a domain, a specific domain of expert for a specific domain for the expert such as a psychiatrist and the psychologist, but it is a universal and rational problems, relational problems, that how the relationship, how what kind of a relationship we have with each other, with the people around us, and with the world. So it says that to come out from this, we just need to expertise to live experienced life with a shape mental health care, and we are the oneself responsible for the recovery of from this problem. Until unless we reach out to someone, if we didn't tell anyone what's going on in our head, how anyone can identify, how anyone can help us in that. So this whole passage is saying that if you are in problem, came out for help. It's just encouragement. Taking help is good thing that doing anything wrong. So that's all for this passage. So hope you guys like it. See you tomorrow with new Eon topic. As of now, have a great day.